we can just zoom back out and become a bit more familiar with this term osteosarcopenia, because I'm sure a lot of coaches listening in and practitioners familiar with osteoporosis, sarcopenia. Can you tie that connection in a little bit more clearly for us?
Yeah, absolutely. So I think a lot of the listeners will be familiar with, as you mentioned, the term osteopenia or osteoporosis. So that was defined over back in, when was it, 1980, as the age-related loss of bone. It causes fragility to bone and predisposes to fractures. But then more recently, in 2015, sarcopenia has come to light. So it was actually first coined back in 1990 by a gentleman, Dr. Erwin Rosenberg, and sarcopenia is the Greek words for flesh loss. But then that's come to light that sarcopenia actually is a clinical condition that also causes falls and fractures. So sarcopenia is to muscle, what osteoporosis is to bone. So it's the weakening, the loss of muscle mass, and then the weakening of that contractile proteins that predisposes to falls and fractures. Now we have a group of patients a subset of patients that actually have both of the conditions, and it's been termed recently as osteosarcopenia. And this both the impact on an individual's mobility and quality of life, and the impact on healthcare expenditure is ginormous with this condition.
Mm-hmm. Yeah, I mean, with the aging population, I mean, we're seeing about a doubling over the next 20 or 30 years, 2 billion people by the year 2050 estimations. Obviously, as you mentioned, greater number of falls, fractures, hospitalizations, even just increased risk factors for other conditions. If we look at root causes here, some of the pathophysiology of osteosarcopenia, between genetics, between just having that physical load, protein turnover, hormonal factors. Can you touch on a few of those and explain how they would potentially be implicated with osteosarcopenia?
Yeah, definitely. So when we look at risk factors, well, we know that advancing age and getting older is a risk factor for every disease under the sun, and that's just
Yeah.
because
We can slow aging, but we can't reverse it yet, right?
exactly, yeah, every organ deteriorates to some degree, if it be your heart, your muscle, your bone, lung capacity, etc. So obviously, advancing age is a risk factor for this condition. And then more environmental factors would be physical inactivity or reduction in physical activity, and then poor nutritional status or malnutrition. And when we talk about those nutrients, we think of what you need for your muscles in terms of protein, and then we think in terms of what you need for your bone, which is both calcium and vitamin D. Um, and a reduction in those nutrients over time will predispose to both sarcopenia and osteoporosis because the role of these nutrients play. But the overarching one here is physical inactivity. And if you looked on a graph, what happens to your muscle and bone mass over time, that would show a linear decrease. So when we talk in terms of, let's focus on bone here for a second, we know you have two types of bone. We have the trabecular, the one inside, the spongy type, and then you have the cortical bone on the outside. And these both decrease across the lifespan. And you can lose by age 80 up to 50% of your overall bone mineral density. And obviously, that predisposes then to a fall and a fracture. Now, at the same time, your muscle mass and strength goes down as well after about the third decade of life. That's around 1% per year for muscle mass. And then they're about somewhere between 2 and 3% per year of muscle strength loss. So it's a bit more accelerated. So if you had a graph, like I mentioned, and you looked at muscle mass, muscle strength, and the amount of bone an individual has, that line would just be slowly going down across the lifespan. But when we hit around the fourth or fifth decade of life, so let's say a middle-aged adult, that's when it begins to creep up a little bit. And that is just because the obvious one is people are become more inactive in their day-to-day lives during that period. And then again, that'll hit at a higher threshold. So that line will go down again linearly when we around age 60 up to age 80. And again, that is because we are more inactive, there's poor nutritional status, and then individuals become institutionalized. So either they might have a period hospitalization where they could be bedbound, and they could be, even during that period, you could be losing a lot more muscle, and to a degree some bone as well. So then again, it predisposes you to osteosarcopenia. Or you could be in a care home somewhere, a care home facility where there's low activity levels. We know that in those care homes, and the nutrition isn't the best either. So you're lacking those nutrients, which we talk about. So really, the main ones are aging, are physical inactivity, and poor nutrition.